Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the articular manifestations of rheumatoid arthritis? So, in the rheumatoid arthritis, what are the articular manifestations? So, if we see the articular manifestations of rheumatoid arthritis, the patient will have pain which is aggravated by the movement is the most common symptom. Along with that, the patient will have joint swelling, joint tenderness will be seen, and there is limitation of motion is common. Okay, in the rheumatoid arthritis, distal interphalangeal joints and sacroiliac joints are not involved in the rheumatoid arthritis. Then, in the rheumatoid arthritis, we have a cyst called as Baker's cyst. Baker's cyst is mainly caused by the extension out pocketing of the inflamed synovial membrane. Whenever the inflamed synovial membrane it out pockets, it results in the formation of Baker's cyst. It will penetrate into the popliteal space, that is into the back of the knee. So that means, for example, if this is the synovium, so if this is the knee joint, this is the knee joint and it is covered by the synovium like this. Okay, sometimes the extension may out pocket into the synovium like this into the popliteal space, resulting in so called as Baker's cyst. Okay, next the main in the cervical spine. If you see the cervical spine, in the cervical spine we see that the axial involvement is limited in the atlantoaxial joint. In atlantoaxial joint, the axial involvement of the cervical spine is limited. Then in the hand joints, we have different characteristics of the hand joints. In the hand joints, there is Z deformity is seen in the hand joints. In Z deformity, there is radial deviation of the wrist is present. There is the wrist deviates radially and there is ulnar deviation of the digits is seen in the Z deformity. And this ulnar here, actually the ulnar deviation of the digits or ulnar deviation of the fingers is actually pathognomic of rheumatoid arthritis. Along with that, there is something called as swan neck deformity is common in rheumatoid arthritis. Okay, in swan neck deformity is mainly due to the extension contracture of the there is extension of proximal interphalangeal joint is present along with compensatory flexion at distal interphalangeal joint. Extension at proximal interphalangeal joint and flexion at distal interphalangeal joint will result in swan neck deformity. Actually, in axial deformity, there is radial deviation of the wrist and ulnar deviation of the fingers are seen something like this. Whereas in swan neck deformity, there is contraction of the extension of the proximal interphalangeal extend this is proximal interphalangeal joint which is extended and there is compensatory flexion of the distal interphalangeal joint like a swan neck, so it is called as swan neck deformity. Then we also have boutonniere's. In boutonniere's deformity, here in boutonniere's deformity, you will see that there is flexion of proximal interphalangeal joint and extension of distal interphalangeal joints are seen. So that means here in Bottiner's deformity, there is flexion of proximal interphalangeal and extension. This is the distal interphalangeal joint which is extended and there is flexion of the proximal interphalangeal joint is seen. So this is Bottiner's deformity. Then we have eversion of the hind foot. can occur, which is at the eversion at the hind foot, that is subtalar joint can occur, or there can be plantar subluxation of the metatarsal heads can occur, or there can be widening of the forefoot can occur, or there can be hallux valgus can occur, or there can be lateral deviation and also dorsal subluxation of the toes can occur, or there can be hammer toes may be seen. So all these are the other deformities which are present in rheumatoid arthritis. Okay, then then there are wind sweep. There is wind sweep deformities are also present. These sweep deformities are present in the toes. That means there will be valgus deformity. In wind sweep deformity, there is valgus deformity is in one foot is present, whereas varus deformity is present in the other. That is called as wind sweep deformity. One has valgus and the other has varus, which is wind sweep deformity. Then we have hammer toe, which is also called as contracted toe. In hammer toe or contracted toe, actually there is deformity of proximal interphalangeal joint of second, third, and fourth toe is present. There is deformity of proximal interphalangeal joint of second, third, and fourth toe is present, thus resulting in bent permanently. The toe will be bent permanently, resembling the hammer, which is called as hammer toe or contracted toe. Similar condition if it is affecting the if it is affecting the distal interphalangeal joint. Deformity of distal interphalangeal joint of second, third, fourth toe leading to the bending permanently is called as mallet toe. Okay, we have hammer toe and we have mallet toe. See, in hammer toe, in the toe, actually there is deformity in such a way that the proximal interphalangeal joint is bent. Like if this is the proximal interphalangeal joint, it is bent like this. Okay, this is the proximal interphalangeal joint. Okay, this is hammer toe. In mallet toe, the distal interphalangeal joint is bent permanently. Then we also have one more thing which is called as claw toe. In claw toe, actually it is similar to claw hand, where there is mm, dorsiflexion of proximal phalanx on lesser metatarso. There is dorsiflexion of proximal phalanx on lesser metatarsophalangeal joint, along with flexion of both proximal interphalangeal joint and distal interphalangeal joints. Like there is like just like claw hand, there is claw toe, where there is dorsiflexion of if this is the foot, there is dorsiflexion of proximal phalanx on the lesser uh, metatarsophalangeal joint, and there is also flexion of interphalangeal joint and also the flexion of distal phalangeal joint. So this is actually the claw toe, just like claw hand.
Thank you and thank you for watching.